The number of open abdominal surgeries globally has been on a downward trend recently, with minimally invasive laparoscopic surgery becoming a more general practice. Just until a few years ago, laparoscopic surgery was conducted by making 3 to 4 small incisions in the abdomen, but this has evolved into a method called single-port laparoscopic surgery that requires only one. In Korea, Dr. Kim Yong-wook is considered the pioneer of this procedure.
Conditions that break out in organs such as the uterus, ovaries, and fallopian tubes require careful and meticulous surgery, considering the physical and psychological effect it can have on the patient. This is why single-port laparoscopic surgery, which uses only one incision and can minimize the invasive nature of the operation, was designed. With this minimally invasive surgical method, there's a doctor in Korea who is giving countless patients more hope for treatment. According to the World Health Organization, in 2012, the number of women suffering from gynecological diseases stood at a total of roughly 1.4 million. The numbers have been on the rise each year, creating greater demand for single-port laparoscopic surgery.
Single-port laparoscopy can be used in almost all surgeries for gynecology. We use it for uterine fibroid, ovarian cyst, endometriosis, as well as other cancers such as cervical cancer and endometrial cancer.
A patient who will receive surgery from Dr. Kim Yong-wook today has been diagnosed with first-stage cervical cancer.
I didn't want to undergo complete open surgery, but the doctor told me I could be cured with laparoscopy surgery and that it wouldn't scar or hurt as much. So I feel more relieved about it, and I'll be getting single-port laparoscopy.
The conventional laparoscopic surgery is conducted by inserting surgical devices into 3 to 5 incisions made in the abdomen. But single-port laparoscopic surgery only uses one incision around the patient's navel to insert the laparoscope and surgical instruments.
Compared to multi-port laparoscopic surgery, where you make multiple incisions around the navel area, the surgery's success rate is similar while leaving a minimal scar. There is not much pain, and recovery is quick as well.
Dr. Kim was the first in the world to succeed in uterine fibroid surgery in 2008 and cervical cancer surgery in 2009. As of now, he has carried out some 2,700 operations, leading the field of single-port laparoscopic surgery. Compared to existing laparoscopic surgeries, the single-port surgery inserts all surgical instruments in one incision, which means it's challenging to maneuver.
단일공법복강경 수술은 수술 기구의 조작이 힘들기 때문에 어느 정도 숙련된 의사가 시행해야 합니다.
It's not only the surgical devices, but parts that need to be removed, such as cancer cells or lymphatic glands that are extracted through the navel incision. This reduces hemorrhage, pain, and even scarring. It's also more aesthetically pleasing. Traditional laparoscopes leave multiple scars on the abdomen, while single-port laparoscopic surgery conceals the scar in the navel. Dr. Kim's performance and studies in this field have been widely acknowledged, being introduced on the global stage through renowned journals and platforms such as the Science Citation Index. Dr. Kim Yong-wook is setting new grounds for gynecological disorders, taking on greater challenges for treatment.